Hi everyone, welcome to my channel. I will go over cholesterol medications that will consist of a pharmacology nursing review. My name is Christina, nurse practitioner. Let's get started. So cholesterol is an essential fat-like substance that is a key ingredient made by your liver that travels in your bloodstream to make new cells. However, when you have too much cholesterol, it can attach to blood vessels within your bloodstream, causing blockage, and it can decrease your blood flow to vital organs that can result in a heart attack or a stroke. So looking at a lab report, you will want to review a lipid panel that will consist of a total cholesterol within normal is typically less than 200 milligrams per deciliter. Your LDL, which is your bad cholesterol, and ideal range is less than 100 milligrams per deciliter. Your HDL, which is your good cholesterol, is greater than 40 milligrams per deciliter and varies for male versus female. Your triglycerides are typically less than 150 milligrams per deciliter. So typically cholesterol meds are added on after lifestyle modifications have been made and diet modifications as well, and there's just no change. So these include cholesterol medications ending in statin, such as simvastatin or atorvastatin. The function of the drug helps decrease LDL, which is your bad cholesterol, and increases your good cholesterol, your HDL, which helps vasodilate, which will help open up the vessels, and it also decreases inflammation. And so the reasons for use would be primary cholesterol to protect and prevent against myocardial infarction and stroke. Some complications for statins would be hepatotoxicity, which can cause damage to the liver, so that is why it is crucial to monitor liver enzymes while on this medication. It can also cause myopathy, which is muscle pain. A lot of patients seen may complain of a sudden onset of muscle pain. A nursing tip, always remember the patient with muscle pain, review their medications and ask them if they are on any new medications that they had just potentially started, and typically it's always a statin related drug causing this muscle pain. Another cause can be rhabdomyolysis. This is when muscle breaks down rapidly, which causes muscle pain, weakness, and confusion. In addition, peripheral neuropathy, which affects the peripheral nerves, it can cause impaired motor and sensory deficits as well. So some nursing considerations would be avoid grapefruit juice. It can raise your statin blood levels, making it toxic. So be careful. Give at nighttime so the medication can be broken down by the liver, and monitor labs such as liver enzymes, that would be your AST and your ALT. In addition, monitor your kidney function such as your BUN and your creatinine. Caution with other drugs as it can cause multiple drug interactions. It can prolong bleeding for those patients taking a blood thinner such as lovastatin and Coumadin, for example. So if after 3 months after taking the cholesterol medication and no change in cholesterol levels, your healthcare provider may consider stopping the medication and possibly switching to another cholesterol lowering medication. That's only with doctor advice. Annual eye exams are also important because statin meds can also cause cataracts, which is typically involved with lovastatin. If your patient is on any immunosuppressive medication such as prednisone, use with caution while on cholesterol medication. As a review, some common side effects would include dizziness, rash, muscle cramps, fatigue, nausea, diarrhea, abdominal pain, flatulence, and pruritus. In addition to cholesterol medications, we also have fibrates that consist of fenofibrate, gemfibrozole, that help decrease your triglycerides and increase your HDL levels. Patients that have a high triglyceride level is usually because they tend to have a diet when they consume a lot of red meat. So some complications from this medication would be myopathy, hepatotoxicity, GI distress, and gallstones. And nursing considerations would be bleeding precautions for those taking an anticoagulant or intolerance to fried fatty foods, and suggest the patient take it half an hour before meals. Thank you so much for watching. Be sure to subscribe for upcoming notifications. Take care.